Hi, I'm Dr. Altaf, and today I want to talk about something that affects nearly half of all adults in the United States, the United Kingdom, Canada, and Australia: high blood pressure. Now, you've probably heard the standard advice: cut back on salt, lose some weight, exercise more, and those things genuinely work. But here's something most people don't think about. While you're busy cutting things out of your diet, you might be missing one of the most powerful strategies available to you: adding the right foods in. Today, I want to walk you through 5 specific fruits that have real published clinical research behind them, research showing they can meaningfully support healthy blood pressure. We're going to talk about exactly what's in these fruits, how they work inside your body, and how much you actually need to eat to see a benefit. No miracle promises, no hype, just honest, evidence-based information that you can actually use. Let's get into it. Before we dive into the fruits themselves, I want to take 60 seconds to talk about why this matters so much. High blood pressure, or hypertension, is one of the leading risk factors for heart attack, stroke, and kidney disease. What makes it so dangerous is that it almost never causes symptoms. You can have high blood pressure for years and feel completely fine, right up until the moment something serious happens. Now, I want to be very clear about something. If your doctor has prescribed you blood pressure medication, please don't stop taking it based on anything you hear in this video. Medication works. It saves lives. What I'm going to share today is about complementary dietary strategies, things you can do alongside your treatment plan, not instead of it. Always work with your doctor when it comes to managing your blood pressure. That said, the research on dietary approaches to blood pressure is genuinely exciting. The foods we eat have a real and measurable impact on how our cardiovascular system functions, and understanding that gives you power. Power to take active, evidence-supported steps toward better health every single day. Alright, let's talk about the fruits. Kiwi. The first fruit on our list is one that consistently surprises people. Kiwi. I know, it doesn't sound like a cardiovascular superfood, but the research here is really interesting. Kiwi is packed with vitamin C, one of the most well-studied antioxidant nutrients we have, and vitamin C plays a direct role in protecting the endothelium, which is the thin layer of cells that lines the inside of your blood vessels. Think of the endothelium like the coating on a healthy pipe. When that lining gets damaged by oxidative stress, which is basically cellular wear and tear from inflammation, poor diet, and aging, your blood vessels become stiffer and less flexible. Stiffer vessels mean higher resistance. Higher resistance means higher blood pressure. So by reducing oxidative stress in that vessel lining, vitamin C helps your arteries stay supple and responsive. That's one mechanism. Kiwi also contains meaningful amounts of potassium, which helps your kidneys balance sodium levels in the body. And that sodium balance is a key driver of blood pressure regulation. So what does the research actually show? There's a well-cited, randomized controlled trial published in the American Journal of Clinical Nutrition that looked at exactly this question. Participants who ate 3 kiwi fruits per day for 8 weeks showed a statistically significant reduction in both systolic and diastolic blood pressure over a 24-hour monitoring period, compared to a control group eating 1 apple per day. A more recent 2022 study examined the effects of eating 2 kiwis at breakfast every day for 7 weeks. That study found a meaningful reduction in systolic blood pressure of around 2.7 millimeters of mercury. Now, some of you might be wondering about the sugar content in fruit, particularly if you're watching your blood sugar. That's a completely valid concern, and interestingly, that 2022 study also measured fasting blood glucose, insulin, uric acid, and triglycerides, all markers of insulin sensitivity. They found no significant negative changes in any of those measures, which is reassuring. In terms of timing, the evidence suggests kiwis are beneficial whenever you eat them. Morning makes sense because cortisol and blood pressure naturally rise in the early part of the day. But there's also interesting research showing that eating 2 kiwis about an hour before bed was associated with improved sleep quality. And good sleep, by the way, is itself an important factor in blood pressure management. One practical note: if you have acid reflux or acid sensitivity, kiwi is mildly acidic, so you may want to have it with a meal rather than on an empty stomach. Pomegranate. Next up is pomegranate. And this one has some genuinely impressive research behind it. Pomegranate contains a group of polyphenols called punicalagins, along with anthocyanins and ellagic acid. These compounds are powerful antioxidants, meaning they help neutralize the kind of cellular damage that promotes inflammation in your blood vessels. Lab studies have also found that pomegranate extracts show ACE inhibitory activity. ACE stands for angiotensin-converting enzyme, and blocking it is actually one of the mechanisms used by a class of blood pressure medications called ACE inhibitors. Now, I want to be careful here, because in vitro lab activity is not the same as clinical equivalence to a pharmaceutical drug. What the research suggests is that pomegranate's polyphenols may work through a similar biological pathway at a much more modest scale as part of a broader dietary approach. Clinical trials do support pomegranate for blood pressure. A meta-analysis of randomized controlled trials found that pomegranate supplementation was associated with significant reductions in both systolic and diastolic blood pressure. The effect sizes were meaningful, though modest, consistent with what we'd expect from a dietary intervention rather than a pharmaceutical one. Now, when it comes to how to consume pomegranate, you have options. Fresh pomegranate seeds, also called arils, give you both the polyphenols and the fiber. Pomegranate juice is also a practical option, but I'd recommend looking for 100% pomegranate juice that's not made from concentrate, because research has found that not from concentrate juice retains better antioxidant activity and higher anthocyanin content compared to concentrate-based products. The one thing to be mindful of with juice is sugar content. When you remove the fiber, which is what happens in juice, you're concentrating the natural sugars, so keep portions reasonable, and if you have blood sugar concerns, eating the whole fruit is probably the better choice. Blueberries. If there's one fruit that has more cardiovascular research behind it than almost any other, it's blueberries. And a lot of that comes down to one family of compounds, anthocyanins. Anthocyanins are the pigments that give blueberries their deep blue-purple color. They're also potent antioxidants, and research shows they support blood pressure through several pathways. They help increase nitric oxide production in the blood vessel walls. Nitric oxide is a molecule your blood vessels use to relax and widen, a process called vasodilation. When your blood vessels dilate, blood flows more easily and pressure drops. There's a well-designed, randomized, double-blind, placebo-controlled trial, which is the gold standard in research design, that found participants consuming freeze-dried blueberry powder equivalent to about 22 grams daily for 8 weeks experienced a drop of approximately 7 millimeters of mercury in systolic blood pressure. The same group also showed increased nitric oxide levels and reduced arterial stiffness. Now, it's worth noting that freeze-dried blueberry powder is a fairly concentrated form. A typical cup of fresh or frozen blueberries is still a meaningful source of anthocyanins, even if the concentration per gram is somewhat lower. The key is consistency, eating blueberries regularly, most days of the week rather than occasionally. Fresh and frozen blueberries are nutritionally comparable, by the way. Frozen blueberries are flash frozen at peak ripeness, so don't feel like you have to buy fresh. If you want to further support polyphenol absorption, some research suggests that consuming blueberries alongside healthy fats, like walnuts or chia seeds, may enhance the bioavailability of certain polyphenols. The evidence here is preliminary, but there's no downside to that pairing, and both walnuts and chia seeds have their own cardiovascular benefits. Avocado. Now, I know what you're thinking. Avocado isn't really a fruit, is it? Actually, botanically speaking, it absolutely is. It's a berry, technically, and it might be one of the most underutilized foods for cardiovascular health. Here's why avocado deserves a spot on this list. A medium avocado contains roughly 700 milligrams of potassium, which is actually higher than what you'd get from a medium banana. And potassium is critically important for blood pressure regulation. Here's how it works. Potassium and sodium are like opposites in your body. When you have adequate potassium, your kidneys are better able to excrete excess sodium through urine. Less sodium in the body means less fluid retention. Less fluid means less pressure on your blood vessel walls. Most people in Western countries consume far more sodium than potassium, and that imbalance is a significant contributor to hypertension at a population level. Getting more potassium-rich foods like avocado is one practical way to start rebalancing that ratio. Avocados are also rich in monounsaturated fats, particularly oleic acid, the same type of fat that makes olive oil so well studied for heart health. These fats support healthy endothelial function, which we talked about earlier. Basically, they help maintain the integrity of that vessel lining. On top of that, avocados are an excellent source of dietary fiber, which supports cholesterol management and helps moderate blood sugar response after meals. I do want to flag one important caveat here. If you have chronic kidney disease, please talk to your doctor before significantly increasing your potassium intake. In the context of impaired kidney function, the kidneys may not be able to process high potassium loads effectively, and that can create its own serious health risks. For most people without kidney disease, aiming for half to a whole avocado 3 to 4 times per week is a reasonable, evidence-consistent goal. Just be mindful of pairing. Avocado on its own is excellent, but if you're eating it with very salty foods like processed chips, you're partially working against yourself. Tart cherries. The fifth fruit I want to talk about is one that most people have never thought of in the context of blood pressure, and that's tart cherries. Tart cherries are rich in polyphenols, including anthocyanins, which we already know from blueberries and pomegranate support nitric oxide production and reduce vascular inflammation, and also quercetin, a flavonoid that has been studied for its effects on vascular resistance and endothelial function. Clinical studies on tart cherries and blood pressure have shown promising results. Research has found that tart cherry consumption is associated with measurable reductions in systolic blood pressure. The effect sizes are in line with what we'd expect from a polyphenol-rich food, meaningful within the context of a broader dietary approach. Tart cherries are also a natural source of melatonin, which makes them particularly interesting for evening consumption. There's evidence that taking tart cherry juice before bed can support sleep quality. And since poor sleep is independently associated with higher blood pressure, that's a genuinely useful secondary benefit. The most practical way to consume tart cherries for most people is in juice form. Look for pure tart cherry juice, not a blend, not from concentrate, and specifically from Montmorency cherries, which are the variety most commonly used in clinical research and which tend to have higher polyphenol concentrations than sweet cherry varieties. You don't need large amounts to benefit. A small diluted portion, a few tablespoons mixed into water, consumed in the evening is a reasonable, low-sugar approach. If you're prone to acid reflux, having it with a small protein-containing snack can help minimize irritation. One honest note here, the tart cherry research base is smaller than what we have for blueberries or kiwi. The results are promising and the biological mechanisms are plausible, but I'd categorize the evidence as encouraging rather than conclusive. That said, tart cherries are a whole food with no meaningful downsides for most people, so it's a low-risk addition to your diet. Alright, let's bring this all together into something you can actually use. The research on all 5 of these fruits, kiwi, pomegranate, blueberries, avocados, and tart cherries, points in a consistent direction. These are polyphenol-rich, antioxidant-dense, potassium-containing foods that support your blood vessels in measurable ways. They're not magic. They're not going to replace medical treatment, but as part of a diet that's already low in processed food and excessive sodium, they can genuinely move the needle on blood pressure. Here's a simple way to think about it. Try to have blueberries most days, in yogurt, in oatmeal, or just as a snack. Add kiwi into your morning routine a few days a week. Incorporate avocado regularly, maybe 3 to 4 times a week. Use pomegranate juice or fresh pomegranate seeds as an occasional addition rather than a daily staple if you're watching sugar. And if you want to experiment with tart cherry juice, a small diluted amount in the evening is a reasonable low-effort addition. These are small, sustainable changes. They don't require a radical overhaul of how you eat. And over weeks and months, the cumulative effect of consistently eating this way can add up to something meaningful. If you're currently on blood pressure medication or have been recently diagnosed with hypertension, please share what you're doing with your doctor. They can help you track your readings over time and make informed decisions about your overall care plan. Dietary changes work best as part of a collaborative relationship with your healthcare provider, not as a solo experiment. I hope this gave you a genuinely useful, honest look at what the research actually shows about fruits and blood pressure. No exaggeration, no miracle promises, just real information you can trust and act on. If this kind of content is valuable to you, evidence-based health education that respects your intelligence and gives you real tools to take care of yourself, I'd love for you to subscribe to this channel. I cover topics like this regularly, looking at what the science actually says, cutting through the noise, and translating it into something you can use in your real life. I'm Dr. Altaf. Take care of yourself, and I'll see you in the next one.